Is it extra work? Yes, but is it extra work dealing with patients that are addicted to opioids? There's always extra work. I mean, I think anybody that takes care of patients, if they're not expecting extra work and extra education, they got into the wrong business. If you really want to help people, then you need to educate yourself on something that could be tremendously powerful for the most common problems in this country: sleep disorders, anxiety, depression, and chronic pain, cancer, sleeping, fibromyalgia, migraine headaches, irritable bowel syndrome, and the list goes on and on and on. So it's basically everybody. So if you want to help everybody, then you need to understand this stuff.